Okay.
And the doctors wanted us to do a head-to-toe assessment, okay? Can you give me your name and date of birth?
Megan Smith, January 9th, 2001.
Okay, let me wash my hands real quick, and can I check your wristband? Okay, Megan Smith, January 9th, 2001, perfect. Before we go over anything, I just want to go over your vitals real quick. Your BP was 112/68, pulse 64, and respiration's 18. Is that normal for you?
Yes.
All right, perfect. So the first thing we're going to do our head exam, which is just head, eyes, ears, nose, and throat. The first thing I want to look at, do you know where you are today?
Yes, the doctor's office.
Okay, you know your name.
Megan Smith.
Okay, and then do you know the President of the United States?
Trump.
Okay, and then do you know what year it is?
2025.
Yes, perfect. All right, looking at you, you look clean, you look well kempt, your hair looks washed, free of dandruff. All right, we're gonna start with your head assessment, okay? Is it okay if I touch you before we
Yes.
start? All right, so I'm just gonna touch your head. All right, no deformities, no abnormalities. And then I'm looking at your skin and everything around your face. I see you don't have any lesions, bumps, any discoloration. When I'm touching you up here, you're very warm. You're warm on both sides. Perfect. All right. So after we do head, we're gonna go to ears. So I'm gonna check your ears. So I'm just gonna take my pen length. If I can find it. My pocket. Okay. And I just want to check inside of your ears. Okay, perfect. And we measure it to your tragus. We're gonna measure it to your eyes. Looks even, and now on the other side, looks even, perfect. So before I begin, do you have any, I want to ask you a few questions about your head first. Do you feel like any bumps or anything like that? Do you have any headaches? Do you notice anything different?
No, ma'am.
Okay, and about your ears, are you having any trouble hearing or anything like that?
No.
Okay, and while we're still in your ears, I want to do a little hearing assessment. So I'm going to stand a little ways back on each side. I'm going to say 3 words, and I want you to repeat it to me. Okay. Car, truck, van.
Car, truck, van.
Perfect. Okay. Steak, chicken, pork.
Steak, chicken, and pork.
All right. Perfect. All right. Now I'm looking at you. I don't see any drooping on your face or anything. Have you noticed any drooping on your face?
No.
Okay, perfect. Your vision looks good.
Yes.
Everything's good there. No speech problems, anything like that, hearing problems?
No.
Okay, now let's start with your eyes then. Alright. Looking at your eyes, your pupils are round. They're very symmetrical. Alright, when I'm looking at it, let's see what this is. Alright, they're at a 5. And then I'm going to do a little light reflex for you, okay? Okay, dilates to a 2. Dilates to a 2. Okay. Now what I want you to do is I want you to focus on this, and then when I say look at the wall, look at the wall. Alright, look at the wall. Come back to me. Look at the wall. Alright, perfect. And they dilate. Right, but love that. And then, like I said, you're not having any vision problems, so like floaters in your eyes, anything like that, anything changes?
No.
Alright, now we're going to do nose. Looking at your nose, that looks symmetrical. Can you hold one nostril for me and breathe? Okay, now the next one. Alright, perfect. And are you having any trouble smelling or anything like that?
No.
Okay, now I want you to open your mouth for me. Okay, I don't see any white lesions. Your lips look pink. The inside of your mouth looks pink and moist. Your lips look moist. Are you having any issues like any sores that won't heal or anything like that?
No.
No? Okay. Now, I'm going to check your throat. It looks even, so I'm going to hold it and I want you to swallow for me. Okay, perfect. I don't see any issues there. Are you having any trouble swallowing or anything like that?
No.
No? Okay, so we just did your hip. Now, I checked your neurological. You're alert and oriented ×4. Like I said, you look clean and everything. You're well put together. Nothing amiss there, anything like that. You don't notice any any memory troubles, things forgetting or anything like that?
No.
Okay, perfect. Now I want to start with your cardiac exam, okay? So before I do that, before I start with the stethoscope and start poking you everywhere, let me just look at your fingers. I want to do your capillary refills. All right, 3 seconds, perfect. I'm going to do it on your feet. plus on that. And I want to come back down here. Do your posterior tibia, 2 plus on that. And then your dorsal pedis, 2 plus on that. Perfect. And then you know all of your, I want to go over all your arteries real quick. You have your carotid right here. You have your axillary up under your arm, your brachial on the bend of your arm, your radial right here. Femoral is where your groin is. And then, your, what is that? Can't ever think of what this one's called. Your popliteal, that's like the bend of your knee. Then your dorsal pedal is on the top of your foot, and your posterior tibia is right behind your ankle, like I was showing you.
Okay.
I can't catch my balance. Alright, now, since we did that, I didn't notice any clubbing on your fingers or anything. Are you experiencing any chest pain, shortness of breath, anything like that?
No.
Okay. Now I'm gonna check your heart sounds, okay? I'm gonna use diaphragm on here, not the bell. We use the bell to check for murmurs and stuff like that.
Okay.
So, we're gonna start with your aortic. Okay. Now your pulmonary. Now your herbs. Your tricuspid. And then, can you lift your breast up for me? This is your mitral. Alright, and then while I'm here, I'm going to check your apical pulse. I'm just going to count it for 60 seconds. Alright, 84, you feel a little nervous?
A little bit.
Okay. Alright, and then like I said, no shortness of breath, no heart issues, chest pains, or anything like that?
No.
Alright, perfect. We already did your cap refills, all that. Okay, let's move on to your respiratory assessment. So I'm just going to listen to the 4 chambers of your heart, okay? Alright. Now, every time I touch you, I just want you to take a deep breath for me. Okay. Okay. Okay, now place this arm over your shoulder just like that. I'm just going to check your lateral. Okay, now the other side. Okay, now lean up for me. Okay. Alright, so are you experiencing any again, shortness of breath? That's another question we can ask you about respiratory. You said no there.
No.
Alright, any trouble trying to catch your breath or anything like that?
No.
Okay, so are you experiencing a cough or anything?
No, ma'am.
You sure?
A little cough.
Okay, so when you cough, what color is your sputum, like your mucus that you cough?
Clear.
Okay, and then do you know what turn, cough, and deep breath is?
No.
Okay, so when you're, you can't seem to catch your breath or anything like that, I just want you to turn on your side. I want you to cough really hard and then take a deep breath. And then, do you know what an incentive spirometer is?
No.
Shoot, let me find one for you. Jesus. Alright, so this is an incentive spirometer. What you're going to do is, so you see this little gauge right here, it's got a little bubble that shoots up and everything when you blow into it. So every hour, 10 times, I want you to take a deep breath into this, I want you to blow into it, and then try to get that little ball up to 750.
Okay.
All this does is essentially exercise your lungs, whenever you like had surgery, you're laying down for a long period of time, like the bottom, like the lower lobes of your lungs, they can expand and they can become sticky because you know lungs are wet and everything because they're like kind of mucousy and all that. So when you're laying down, your lungs can't fully expand. So that's essentially what that's for in the central spirometer.
Okay.
All right. So now that we've done that, let's see. We done chest, or we done cardiac. Oh, one more thing while we're still on that. Can you just turn your head this way? I want to check your JVD or your jugular vein distension JVD. Mixing my words up in that way. Okay, I don't see any JVD. Perfect. All right. Now, what do I want to do? Let's do your gastric assessment real quick. And while we're on that, I do want to mention the Glasgow scale, which all that is so what we look for is like your eye movement, your mobility, and then if you can like let's see, your speech. Yeah. So on all of that, you would score a 15, which is like, you know, you're doing great in all the categories. But we usually do that. We do that with all patients when we do a head to toe. It's mainly for like if you're in a coma or you had TBI, something like that. How like if your eyes are reactive, the type of mobility you have, and then how well you can speak. Like, you know, kind of like with stroke patients and everything, they may slur your words and everything, but you're not slurring your words. You have very good speech. And then also I want to, with the you know, then central spirometer and everything and laying down, I want to talk about the Braden scale. What that is that's your risk for how likely you are to develop like a bed sore or like you know, a pressure ulcer. Like when you're laying down for long periods of time, your skin can become weak because there's so much pressure right there, and then you can have a sore or something like that. Okay. And then 3 different factors of that is like your mobility, if your body stays moist, and then your nutritional status. Okay. And then there's a few others, like, you know, smoking or stuff like that. Yeah. Okay, now I want to check your gastrointestinal. And all I want you to do is I just kind of want you to slide down. Normally we would do this laying down, but it's okay like this. Okay. All right. And then before I start, are you having like any abdominal pain, anything like that?
No, ma'am.
Okay. Or anything like that? No?
No.
Okay, perfect. And I had to ask, when was the last time you had a bowel movement?
I would say this morning.
Okay, so how many hours ago?
Like 8.
Okay, perfect. Alright, perfect. Now I want to go over your musculoskeletal. While we're still on that, like while I'm just touching you and everything, I just still want to check the temperature of your skin. I want to make sure you're free of wounds and everything. You don't have like any moles or anything that, or anything like, you know, say like a mole that's unchanged or any wounds that aren't healing or anything like that?
No.
Okay, and then your skin feels warm and attacked. Okay, so let me write that down. What I want to do for range of motion, we're going to do your elbow and wrist and then your knee and foot. Okay?
Okay.
So for elbow, flexation is bend, just like this.
Okay.
And then extension is straighten for me. So flexation for me, and then extension. Okay. Extension. There you go. Oh wait, I was wrong. Okay, flexation with resistance, and then extension. Okay, perfect. Flexation bend, then extension straight. Alright, flexation. Okay, extension. Alright, perfect. Now we're just going to do your wrist, and then supination is up, pronation is down, okay? Supination, pronation, supination, pronation, okay? Supination, pronation. Okay, perfect. Let's go back around to the other. Supination, pronation, supination, pronation. Okay, there we go, perfect. Alright. now we're gonna do your knee. And same thing. Flex is in, extend is back down straight. So flexation, extension, flexation, extension. Alright. Flexation, extension. Alright, perfect. One more time. There you go. Come back down. Okay, perfect. Now we're gonna do your ankles. Plantar flexation is down, dorsal flexation is up, okay? So plantar flexation, then dorsal flexation, plantar flexation, dorsal flexation. Okay, perfect. Plantar flexation, dorsal flexation, plantar, dorsal. Alright, perfect. It's very strong. Alright, now let's do your gait.
Okay.
And you're just gonna, all I'm checking is your gait and your balance, and you're just gonna walk like this for me, one toe in front of the other, and then just straight like this, and then turn around, heel to toe, and then after we do that, we're gonna walk on our heels, just like this.
Okay.
And I want you to look forward. If you stumble a little bit, it's fine.
Okay.
A little bit difficult to do it. Alright. Okay, back. Alright, now heel. Alright, perfect. Now, I want to, are you having any troubles with your balance or gait or anything like that? Are you having like, a little bit of unsteadiness?
No.
Okay, and then with your musculoskeletal system, are you like, are you in any pain? Are you having any issues like, bending, picking up stuff, like, anything like that? Like, when you do exercises with your wrists, anything like that hurting?
No.
Okay, perfect. And then I want to go over your gyratory. It's like your urinary system, basically, that your genital area. I just want to give you like some education on a catheter. For a female catheter, usually when we do an indwelling Foley catheter, we use 14 French. That's
Okay.
like the gauge of it.
Mhm.
And then what a Foley catheter basically is we go in through the urethra and we go into your bladder. And all that is usually we'll do that when you have urinary retention, or you're usually having like recurring UTIs and you can't drain and void your bladder like you need to. So what we'll do that is we'll just put this little tube up into your bladder, and then it'll drain out. When you are going to the bathroom, is your urine, what color is it?
It's on the paler side.
Okay, and then you don't notice any sediment, or is it any cloudiness or anything, no odor?
No.
And then when you are urinating, are you having like a burning sensation, anything like that?
No.
Okay, perfect. Alright, let me just refer to this real quick just to make sure I have everything for you. Okay. Let's see. One thing I didn't do. I didn't check for edema. So let me just check for edema in your arms and then your legs. Just pushing down. Alright, I don't see any edema in either one of your upper extremities. And then no edema in your lower extremities. Okay, I think we're done here. Do you have any questions for me?
I don't think so.
Alright, well the doctor will see you shortly. Alright,
Thank
thank you. Okay.